So Dave, talking about new products, there's also a product that you have now said you're going to delay a resubmission to FDA on. And I'm going to try one of those complicated words. We'll see how far I get. It's baricitinib, as I understand it.
Correct.
Arthritis drug.
Yes.
What's going on with that? You're going to delay. It's not going to be in 2017. You're going to resubmit to the FDA. How important is that to you?
So it's important. We had mixed results on baricitinib in the quarter. As you're pointing out, the FDA issued what's called a complete response letter, and then we had a meeting with them to follow up on the details of that. We now understand that they don't agree that our submission has a positive risk-benefit, and they'd like us to do some more work before resubmitting. By the way, we don't agree with that conclusion, and neither does Europe or Japan, who just approved the drug and where we're launching now. We'll work with the FDA. We're committed to get this drug to patients with RA, which is a huge unmet need area. And baricitinib appears to have some really unique features. We just have to work through the regulator here in the U.S. By the way, I should say baricitinib also has many other indications of interest to us and clinicians in autoimmune conditions like lupus and atopic dermatitis, and we're committed to pursue those despite this setback at the FDA. I'll finally say we've launched in Europe, and we're off to a great start with baricitinib there. So we're committed to this molecule. It's one of 20 new medicines over the 10-year span from 2014 to 2023. So it's important, but not pivotal to the story.
So Dave, finally, you have committed more or less to have 5% revenue growth annually through the next several years. What is the biggest risk to that number? I mean, if you were not to make it, what would keep you from making it?
Well, David, of course, we model across a range of scenarios what our potential performance is, and we're confident we can get to the 5% under a variety of those. But we did say there were two big factors that were outside of what we modeled and that commitment. One was an early patent expiry for a product called Alimta, which is used in lung cancer in the U.S. There's a so-called inter-parties review hearing on that patent that's already occurred. We're waiting for the answer to that. If that patent is rolled back and we have early patent expiry, that would materially affect our ability to get to the 5%. The other issue is what the federal government decides to do. And if anything dramatic happened on drug pricing, we couldn't stand behind that commitment. But barring those two things, we have a lot of ways to get to 5% growth or more. And you're seeing in Q2 an 8% top line. That's the kind of performance that we'd like to continue to deliver.